Hi, this is Dr. Ravindra Mehta from Vayu Chest and Sleep Services in Jayanagar, Bangalore. And the idea of making this video is communication and education of our colleague providers who are dealing with chronic respiratory and sleep issues and want to know more about what's going on in contemporary times. What we plan now is an engagement where we try to educate you more on what is the latest and greatest in these chronic respiratory diseases and try and make it easier for you to both manage these patients and if required, offer them higher facilities which will be imperative towards overall health improvement. Now, as a basic a teaser, let's start with some chronic respiratory diseases which you see on a day-to-day basis. Let us start with asthma. Asthma is one of the most common respiratory diseases. India is the asthma country of the world, and we have the maximum deaths due to asthma, which is one sad point. Now, what is new in asthma? What has shifted focus in the last few years, and what is so important in current times? The first is make an accurate diagnosis. The second is try to figure out the severity of their asthma. The third is do a spirometry, which is so important. The fourth is use the GINA guidelines to try and figure out where they stand. And most importantly, in treatment, we have so many new aspects, which include inhalers, different types of inhalers, anti-inflammatory aspects, and new drugs called biologics. In a nutshell, and this is just the beginning, and we'll be sending out more videos to try and educate you on at a higher level. The focus of asthma therapy is diagnose them correctly, stage them correctly, and use medications to address two major aspects, inflammation and spasm. And when these two are taken care of, you will get control of most of your patients. Otherwise, the new tools in the armamentarium are biologics, very new injections out there which make a difference, and bronchial thermoplasty, a procedure which came in asthma to try and reduce exacerbations and improve quality of life. This, in a nutshell, is asthma, and we'll be happy to send out a subset of further videos dissecting these aspects in a very user-friendly and simple fashion, so you don't have to wade through tons of literature or have to go through many papers to understand this, and it is practically available to you in your day-to-day care. Let's shift gears. What about COPD? COPD is so well known to us. And as a very brief précis, COPD at this point has a new way of looking at it in 2024. In 2024, how do we look at COPD? A, make an accurate diagnosis. B, distinguish it from other respiratory disorders such as asthma or look for overlap. Then after that, try and stage it properly as per recent guidelines. And again, here the mantra is very clear. Functional capacity of patient has to be looked at. Their exacerbations have to be looked at. And improving their overall quality of life is becoming insurmountably important as making a difference in their care. So we now look at COPD very differently. We tend to diagnose it better. We tend to diagnose it earlier because you will then improve the trajectory of their disease. You will then do appropriate spirometry, and then you will go ahead and decide what medications are important. After you're doing a medication strategy, which is also now changed into multiple inhalers and so many other variations, you're now looking at combination inhalers in multiple strengths of anti-inflammatory and bronchodilatory aspects. And more than anything else, there is now the overall comprehensive treatment of COPD. And what does that entail, ladies and gentlemen? It is addressing their comorbidities, educating them about their disease, looking at vaccination, which has become so important. And if there is one message I can give you, it is pulmonary rehabilitation. Humbly, we have to admit that it is not that every disease can be fixed by medications or surgery. This nutritional, exercise, preventive, empathy, multimorbidity approach is so important in trying to treat a disease, and COPD exemplifies that like none before. Few disorders will have patients with you for a long period of their life, and that is COPD. So in 2024, many new changes have come, which makes a big difference in their management. And then came another hammer. And the hammer is procedures. There are new procedures in COPD such as lung volume reduction, and we do that bronchoscopically so as to make a difference in their care. In short, we have now talked of asthma and COPD. We will be also, showing two cases over here in this particular session, which will help you to understand this multimodality management. And we will develop our discussion with trying to dissect all these aspects into smaller, comprehensive, and useful areas which you can learn very quickly and utilize in your practice. Thank you.